morning. I am Dr. Sambi Abraham, Director, Abraham's Infertility and Gynec Center. Infection of the uterus, tubes and ovaries is not uncommon. You know that this is the cervix projecting into the vagina. So what can happen is that an infection can spread from the vagina to the cervix, to the body, tubes and ovary. So like that the patient can have symptoms. So once there is an infection of the tube, ovary, it can cause problems to the patient. It can present as irregular bleeding, lower abdominal pain. This pain can sometimes make an appendicitis. There are instances where the appendix has been removed, but even after removal of the appendix, the pain is not relieved. Now what happens there is that the local resistance to the infection there gets altered. We know that there is a policeman and function gets disturbed. There will be trouble in that area. Like that, once the defensive mechanism of the lower vaginal tract gets altered, an infection can spread through the cervix, to the uterus, to the tubes and ovaries. It can cause chronic symptoms. The patient may be suffering with all these symptoms of pain, abdomen, frequent urination or frequent passing of stools, but even then they will have the urge to void or urinate. I mean to say that it makes their life difficult. So it can be due to an underlying infection, it can be due to bacteria, virus, fungus, all could be involved in that. And sexually transmitted diseases also can cause infections like gonorrhea, chlamydia. So we have to be careful in our act. Before the sexual act, that area has to be cleaned with soap and water, both the partners. So cleanliness is very, very important. And sex with multiple partners definitely carries the risk of sexually transmitted diseases and inflammation of the tube, uterus and ovary. So what can happen is that once there is a chronic infection, the function of the tube gets altered. We know that it is in the tube the sperms and eggs meet. So once the tubal function gets altered, infertility can be there, ectopic pregnancy can be there. Infection of the ovary can lead to irregular bleeding. Abnormal bleeding can happen. So once this is diagnosed, it has to be treated promptly, and the instruction of the doctor has to be followed. Sometimes if there is a difficulty in diagnosis, a laparoscopy will help you. You can see the evidence of infection, and sometimes you can see that the infection spreads along the liver area also. So what I mean to say is that if a lady develops irregular vaginal discharge, pain abdomen, sometimes vomiting, chills, frequent attempts at urination, frequent attempts at defecation, all these symptoms could be due to an underlying infection. And if it is found, it has to be treated promptly and systematically. When regarding your sexual habit, you have to be careful, because infection by sexual act can cause these problems. Human papillomavirus infection can lead to cervical cancer later in the life. It may not have much of symptoms, they may be having warts-like projections, but it can later cause cervical cancer. So every lady has to be more careful about that. Any lady from 21 years has to do the cervical smear test, pap smear test, and combine with human papillomavirus screening if they are sexually active from 21 years onwards, once in 3 years. If they are combining cervical smear and human papillomavirus screening, they can do the test in 5 years. So you have to have a prompt treatment of these symptoms. If we neglect these symptoms, it can later cause problems.